There we go. There I was.
Just I was trying to send to you. I'll do that after.
You're there. Is your audio on?
Can you do that?
Yes.
How'd you do that before?
You just have to kind of, let's see, how's that? Won't you run?
I can hear you. Delivery. I don't know. I didn't open it. Okay. I'll give you a tip later.
Yeah, my tip is watch yourself.
Can y'all hear me?
Hello, I can hear you.
Okay, good.
Hello, hello.
Shelley, I can hear you, but your picture is not, it's not a live audio, it's just a picture.
On a live audio, I'll have to get on a laptop.
There's Elizabeth. Hello, Elizabeth.
Hello. Where are you, Treva? I don't see you.
I don't know. It just has a T up here for me.
You're just T for Treva.
Well, let me see.
Undo your video. Click that button.
Live on YouTube. I don't know.
It's always a mystery.
Oh, yes. Well, it's different every time you turn it on. Have you noticed that?
Exactly.
It's the same thing. Whoops. Okay. Ah, there. I found a start video.
There you are.
Okay. So we need somebody to tell jokes or something.
That's David's job.
Oh.
David's muted, so he can't participate.
Okay. Oh, there's
Well, I hope we get a few more. We don't have a quorum.
I'll give them a couple minutes. It'll take a couple.
Shelley, there's still no live video on yours.
I'm working on it.
Okay.
It's a good picture, though. You might want to just keep it.
It's a good picture.
There's Roxanne. Hello.
I don't see it, Roxanne.
She's down on the bottom right.
No, that's where Shelley is on mine, so I don't know.
Deborah.
Oh, okay. There's Roxanne. Gee, Roxanne's at the beach.
I wish.
She's got ocean and palm trees.
I'm always jealous of her backgrounds.
I know.
Has anyone said they will not be here?
I haven't heard from anybody. So I don't know. We probably ought to wait just a few minutes. 1, 2, 3, 4, 5.
Oh.
Elizabeth, what's a quorum with, we've now got 11 members, don't we?
Yes, we do.
6?
Yeah, one more than half, so yeah. I think.
Do we get to count Amy?
No, Amy doesn't count. I mean,
Okay.
you count, but not for a quorum.
Is Joe coming?
That's a problem if she's not. Shelley, did you hear from Joe?
I didn't hear that she wasn't coming, so, but I think she's waiting to get in. Hold on.
There she is.
Ta-da.
I think Mr. Nielsen said he was gonna join us.
Shoot, that was an aerobics act trying to figure out how to sign in last time.
Shelley, can you resend the meeting link that you sent this morning to Alpha's email? She's
Yeah.
trying to get on.
Okay.
Oh,
I had a little trouble signing on today. It wasn't as easy as last time.
That's why I was late to the meeting, because I was trying to figure out what my password was. And then it said, lucky for me, Zoom remembered and said, oh, you signed in with Google sign in last time. I was like, okay. It said click on that, and then I was able to get in, so.
Shelley, have we heard from our new board member?
Yeah, he said he was gonna try to, be here for Zoom. He's in Ohio or something.
Okay. Well, I guess we could go ahead and start. We've got 6.
Kay said she's having trouble logging in. I resent hers.
I'm sorry.
Kay was having trouble logging in.
Okay.
Shelley, Alpha said she hasn't gotten that from you yet.
Okay.
Kelly, usually like with Zoom, I just had to click on the link and it'd take me to you and you'd let me in. This was a little different. Do you know why?
No, I don't.
I ended up signing in on the one you sent, not the first one, but the second one.
Second one.
The second one is the one that asked me for my email, my
Yeah, it
password,
did.
and
Me too. I just logged in through Facebook.
that's
He asked me the same thing too. And of course, I didn't remember my password, so we had to go reset one.
I went to reset and it told me, hey, you signed in with Google last time. I was like, okay. It said, click that. I did, and and then I did my password, whatever. And I found my password.
I think Rob's on the phone. I recognize the phone number.
Yes, it's me. I was having trouble too, so I just cheated and did the phone. So.
Who is that?
I'm having
Rob.
Rob. That's what I thought. Just want to make sure. Thank you.
Who had talked to Kay that she's trying to log in?
It was, she sent me an email and I sent it to her and Alpha and.
I'm texting her.
Yeah.
Telling her the different ways I got in case she's having trouble. Or the way Deborah got in and the way I got in.
You might even, they might even want to call in like Rob did.
Yeah, that was pretty easy. I thought I was late, so I just cut the try.
Rob, which phone number did you use? Alpha wants to know.
I just called the first one from New York.
Okay.
And then it.
One. Okay. All right. Let me.
Okay, thank you. Alpha said she's just gonna hang up. Had her on the phone while she was trying to get in, so she's just gonna dial.
Yeah, I did that first number from dial from your location from New York, and then it asked for the rest of the numbers after that, and it connected right up.
Amy, does everybody else have as much trouble as we do with technology?
Honestly, I think because I had trouble getting into, and I've never had to, it said that I had to log in order to get into this meeting. So it may be something that was set up with this specific meeting because I've never had to do that before. So I have to create an account in order to log in today. So maybe it may be something that Zoom did on its own in an update or something too, because I've never seen that come up. Obviously, I've been on Zoom before and never had to sign in on anything because I didn't have an account. But there's any number of things it could have been. So
I wondered if it had something to do with the fact that, because it said it's streaming live on YouTube. That's what it told me. So I'm wondering if it's because we're having to record it and all that stuff.
Yeah, that's my thought too.
I didn't have any trouble getting in, but I had an update last week and I went ahead and did the update. So that hasn't changed. If anybody's updated Zoom lately.
I think it is because we have to be verified as invited.
That's what I thought.
Dwayne I'm gonna give Dwayne the information. He's gonna try to call in too.
Yeah, because I think he's having trouble.
Oh, so Kay, I'm just going to tell her to call in because I'm just telling Kay to call in because she said may not make it, don't know how to get in. So I said just call in. She's not able to recall her passwords. The same problem
I ended up never having to put in a password when I went through Facebook.
I think you have to set it up with one along. Oh, you mean this time?
Yeah.
Oh, okay. Let me tell her that. Don't need password on Facebook.
You have to put in your date of birth though.
Oh, gosh.
Do that.
Next up.
I'm in by Zoom.
This
is Alpha.
Oh, Alpha's on.
This is, yeah, by phone. Okay.
Who is that, Kay?
Alpha.
Alpha, okay.
Okay, let me send Kay the phone number. Can you tell me what it is?
Yeah, hold on just a second.
646
646
558
558
8656.
8656. Thank you. I'm just saying
And
call
then
that number.
You may need the
you
password.
yeah, you also need the passcode.
Okay. Is there one? Oh, the same, whatever was on our email. Can somebody just tell me?
789944.
Thank you.
You're
I'm
welcome.
just,
I had logged out of all my email and everything, and I'm texting her so she can get in, and she's just read it, so she'll probably call in.
I only had, is it 2 9s and 2 4s? I only had 1 9.
Oh,
I
good.
think 9.
It's 2 9s to call in?
The passcode.
Yeah, Rob, to call in, was it 2 9s?
Oh, wait a second, I've changed. Give me a second here.
Oh, it's okay. I just told her to call in if all else fails, so let's see if she can get in.
Yeah, it's 29789944.
Okay, good.
That's correct, yes, 2 9s.
Yeah, I've told her, so hopefully she'll call in, but she could still be trying through Facebook or something else.
So we are live on YouTube right now.
Shelley,
Yeah.
are we?
Yeah.
It's Kay. I finally made it on the phone.
Okay. I think we're going to go ahead and start. The only one left is Kevin and our new member.
He's
So
working on it.
go ahead. I couldn't hear you, Roxanne.
Oh, I was just saying, Dwayne, I'm resending him the stuff. He's gonna try to get on via the phone as well.
Okay, Shelley said he's in Ohio or something working. So let's go ahead and start. I don't know where Kevin is, but let's go ahead and start. Joe, has everybody had a chance to read the minutes, and does anybody have any changes or suggestions? If not, do I have a motion to approve the minutes from the last meeting?
Move to approve. It's Kay.
Second.
Roxanne, I second.
Anybody opposed? Minutes or, whoops. There's Dwayne.
Would it make more sense for me to ask for?
There's Dwayne. He needs to unmute.
Are you talking to us, Dwayne? You're muted.
Hey, sorry about that. How's everybody doing?
Are you in the great state of Ohio?
I am in the great state of Ohio.
Okay.
Hey, Roxanne. Hey, Deborah.
Okay, we've just approved the minutes. Joe, nothing else from you. So Treasurer's report, Trevor.
okay, I think we should probably start this treasurer's report by expressing appreciation to Shelley. She applied and received the $15,000 Hallmark grant. And if you look into account number 3268, we have the $15,000 recorded in there. Plus, if you'll remember last month, we had $2,300 that was additional in there, it's also, that's an East Tennessee Foundation Literary Grant that we received for children's online books. This HowMat grant, I think, is going to be used primarily for some programming and also purchase of materials. And if you'll look at our hotspot income and expenses, we have a net income of $36,000, which is still showing a good percentage of income to expense. And what we had hoped to do was to recover lost revenue from the COVID shutdown of about $37,000, and that would be expressed in accounts, the fines, the copier and printer charges, other charges, which is primarily lost materials, community room fees. So we would like for the net income from hotspots to cover those, plus also the unmatched employee benefits that we have now. So like we're going to make it. If you look at account 5100 material expenses, that is up above percentage wise for this time, but we have had several annual expenses that are included in there. There was a $1,600 creative bug database that's an annual fee. There was almost $3,000 in there that was for prior year orders that were not included, and we were not billed for them until July of this year. And those items may be adjusted out when the accounts audited. We also had some annual newspaper subscriptions, and then we had a $2,230 charge this month for annual magazine subscriptions. So there's several things. Well, the materials expense should sort of level out by month over the next few months if you consider all these things annually that we have paid. I think that's it. Everything else looks pretty much the same. Good. Any questions?
Yeah, any questions? There's Shelley.
Hey,
Good job, Shelley.
Hey, you're in two places.
I'm in two places.
There's one picture of you up there.
Yeah. I'm gonna leave it up because it's the one running the meeting.
Okay, if there are no questions, let's file the report for the audit. Treva, anything for finance, or were we pretty well covered with?
Yeah, I think we probably pretty much covered that in the, with the hotspot idea of what we're hoping to cover, regular expenses with that, where we sort of have that designated.
Okay, if no further questions, Elizabeth, anything from personnel?
No report.
Kay, policies?
Just that you and I and MUS attorney worked on updating the agreement between MUS and the library and the health department. If you want to bring everybody up to date on that, I think it would be good.
I think that's going to be under unfinished business. If you look at the agenda, down.
Okay.
Yeah, you see that Roman numeral 7 will because that was brought up in September when the original agreement was signed. So we'll get to that in unfinished business.
Okay.
Anything else in policies, Kay?
No, not at this time.
Okay, Alpha, long range planning.
No report.
Deborah, the building and grounds, this agreement with the health department that Kay mentioned will certainly involved building and grounds, and we kind of had to move quickly on our feet with that, and I'll explain it later. But do you, obviously that has some building and grounds implications, but other than that, do you have anything we need to talk about?
No, nothing to talk about on building and grounds.
Okay. Deborah, nominating.
Welcome, Dwayne.
Finally.
After Thanksgiving. Thank you all. I appreciate it so much.
Dwayne, you're coming in at a weird time. We're not real good at Zoom, but we're trying.
That's okay. That's okay. Everybody looks pretty. Just, yeah. Hey, Joe, Rana Prasad, hey.
Reva, anything in purchasing?
No, I think not. We've covered it.
Okay, in unfinished business, let me give you some background on what Kay mentioned, the letter of agreement. You might remember back in September, Shelley brought up that the health department would need some space from us and from MUS for both flu vaccine and the COVID vaccine. And in September, a relatively short agreement was signed that I think Shelley brought up at that meeting that was between the health department and MUS and us as the library. It was a relatively short agreement without a whole lot of substance to it, other than the health department needs parking lots to have space for what we think will be a relatively busy crunch particularly when the COVID vaccine gets here, for cars to drive through. As we got closer to, well, last week was the start of the flu vaccine. Kay on the city council raised a question about whether there was enough detail in that original agreement. And and I did this without calling a board meeting because we were basically trying to get through before the flu vaccine started. Last Thursday, I think, was when the flu vaccine started. So we were also basically just trying to supplement the original September agreement a little bit. But anyway, with Kay and Shelley, I talked to Lauren Carroll, who is city attorney, and Lauren, on behalf of MUS, had some suggestions, and I think she'd had some contact with Clark Rucker at MUS previously, and she had some suggestions on some things, and she tweaked the original September agreement with what we called an addendum. Primarily, the changes had to do with liability. In other words, with all these cars coming through both parking lots, how would we handle any problems or any damage? She got that done. It looked fine to me, but it went to the county on behalf of the health department, and Chris Capps, the county attorney, and Bill Britton wanted to change some language that the county has limitations on how they would be responsible for damages. So Chris Capps tweaked it a little bit, and Lauren approved it, and I approved it, and Shelley signed it, as did Clark Rucker. I think you've got a copy of it there.
It's in the director's report.
Yeah, it's in the director's report. So they signed it, and it was a little bit of a scramble because we wanted to get it done before the flu vaccine started last Thursday. And I think the thought was and my talk was mostly with the lawyers talk to lawyers because nobody else will talk to us. But with Lauren and Chris, the thought was if we need to change it again, nobody seemed to have any real agenda here to make things difficult. So it may have to be tweaked again before we get to COVID. Shelley, I guess I need to hear from you how, I haven't really noticed with flu vaccine, are they backed up or what's been, when they started last Thursday, how is?
That was only, David, that was only a one-day event.
Okay.
And
Yeah.
Marshall and I went through at 2:00 and we were the only people there.
Deborah, I'm having a hard time hearing you. I don't know what your audio is, but say that again.
Marshall and I went through and got flu shots last Thursday at 2:00, and we were the only car there.
Okay. So not much going on with the flu vaccine. And Shelley, are there any more of those coming up? Or are we just waiting for COVID now?
As far as I know, we're in the waiting stage now.
Okay. Well, Kay had some concerns, and we were in such a scramble. I'm not sure we got everything addressed. We can certainly bring up anything else, but Kay, that's a kind of a long-winded explanation. Do you want to add anything? I think she's muted. She may not know she's muted.
I just sent a message for her to unmute.
Yeah, there you are.
Okay.
Okay, thank you, Dave. I think you did a great job explaining it. I believe total there were 174 that went through for the flu vaccine. I noticed they did put up, the barrier was something that they left out at the final agreement there. And I drove by the other day, they had put up orange and white striped, partition that can be moved pretty easily. I don't know if Shelley's noticed it, if anybody's trying to drive around it or not. It's,
I haven't seen anybody.
Good. Before that, I saw the shredded truck go through there and another truck going across. But I think that we can, get together and talk about it. Next Wednesday at the Rotary Club, they're going to have a Zoom meeting with the Nashville people about when they might be bringing the COVID vaccine. So as we find out when that's going to happen, we may, look at and talk to even the officers that were there, and Deborah and Marshall's input is good as well to see what there might need to be tweaked. As you said, we all want to work together. This is very important, but we need to be careful to be sure we're covered liability-wise.
Well, there's a lot of moving parts to this. The city has to have police officers there, and I think we can all imagine how big a mess this will be when the COVID vaccine is opened up to everybody. So it is kind of a fluid thing. Kay, the barriers, I lost track. I had several things going on while we were dealing with Lauren Carroll and Chris Capps. The barriers are not in the final agreement.
No, they aren't. But there were some that were put in place. I sent a note after I saw that final without the barriers to Sherry and copy Bill Britton, because he said at one point that he would put them up, just noting that needed to be, because the county is going to be responsible up to a certain point for liability. I would think that they wanted to be sure that the route is only used when it's supposed to for vaccine purposes, and that other people aren't there.
Well, I assume we're several months away from COVID being available to everybody. So we've got time if we want to change that addendum, as long as the county agrees and the of course, MUS doesn't have a whole lot of different position on this than we do. They just don't want their parking lot messed up or any damage. So we're pretty much on board with them. So we've got some time to look at it, but at any rate, you have a copy of the agreement that was signed last week. I don't know that as a board, we need to do anything at this point. Unless somebody, Kay, do you want to make a motion, or you want to just put it on hold until we get closer to the COVID distribution?
Yes, let's put it on hold and talk to the people that were involved in motioning the traffic through and see what they have to say as well. And then we can see what kind of, Shelley can keep an eye on the barrier and make sure no one's moving it. Difference between us and MUS is we do have people that are, driving through our parking lot even if it's curbside, we still have patron citizens coming through there. So let's put it on hold and evaluate it.
Okay. And, I don't know the details of this. Kay is much better versed in it. But, when this thing starts, they're going to be all the way backed up potentially to the Baptist church. Shelley, is that not the plan?
Yeah,
I mean,
it is to go through the First Baptist Church parking lot, winding through there, and then across to the MUS, and then through the library and on out past the health department.
So it's going to be a major operation. So we probably need to see that we're as prepared as we can be on all issues before the vaccination period starts, I guess. Okay, anybody got any further questions about that or comments? Okay, we'll leave that to be completed if need or worked on before the COVID vaccine gets here. Shelley, the director's report, obviously that was part of it. If we've covered it.
That's fine. I just put in the director's report that we would probably stay the same as far as opening, that we would be the same as we have been, limiting to 5 people at a time to use computers or make copies, and doing curbside.
Are you comfortable with that? Because the numbers aren't good. They're getting worse. And,
I know it.
Before, kind of refresh my recollection, we weren't letting anybody on the computers, were we, back in the summer when we shut down?
That is correct. Yeah. We were not letting anybody in at all, just doing curbside.
Well, are you comfortable with that limited sort of plan, letting people in? It's scary.
It is scary, and there has been 2 people that have come in here, and we found out afterwards that they were around people that had tested positive for COVID, and they just ignored it and came on in anyway.
I think we've got a lot of that going on, unfortunately.
Yeah.
Any staff issues with quarantine, that sort of stuff? Are we okay there?
We're okay. Yeah. No issues there.
That we know of, anyway.
That we know of.
Yeah. Okay, I guess that probably needs a motion to continue the same plan, which is curbside modified, I guess, if we want to call it that. Does anybody want to make a motion or discuss that further?
Also move.
Second?
A second.
David, do we need to put in, like we have been, where we say, if it needs to change, that you and Shelley can make that decision, and we add that addendum to it? Like if we need to shut it down lower, you don't have to come back to the.
Yeah, Roxanne, I'm having a hard time hearing you. Was the question, do we want to, if we have an immediate situation, to give the chair and the director that authority?
Yes, sir.
Was that it? Okay, that's a good thought. And I guess we did that last month maybe, but we probably ought to reinforce it. Is any discussion on that? And
I do want to say something. We don't usually meet in December, so do we want to carry this forward to January?
yeah, that's true. Kay, that comes into play on that COVID thing too. We're not going to be back together until January. So, and I don't know that that's a problem because I'm not sure. I think you're going to have limited distribution before January, but in terms of what Roxanne is talking about, who knows? Like I'm some sort of here, but I could see this thing being a total mess in a month because it's. You know, the trend is really bad. We all know what's going to happen with Thanksgiving, and you know,
Right.
we're all trying to deal with that as best we can. But I think it's kind of like a freight train on the way. We know what's coming. So do we want, Elizabeth, you made the original motion. Do you want to include Roxanne's
Yes.
portion?
Yes.
And let me just say this. I know it sounds like I'm trying to avoid special call meetings, but it's just hard to get everybody together, and did that several times on sewer pipes back when that was the only problem we ever had before COVID. And I don't mind a special call meeting. It's fine, and we've got provisions for that in our rules, but it's just really hard. And that as you heard Kay and I talking about the vaccination thing, when it becomes that fluid, it's just really difficult to try to get everybody together. And part of the problem we had there was they were changing that agreement every 30 minutes. And if I'd called a special meeting, it wouldn't have mattered because 30 minutes later, they'd add a different tweak to the agreement. So I know it sounds like I'm trying to avoid the board with what Roxanne is talking about, but this has just been so different than anything we've ever had to deal with that if it is really bad around Christmas and we need to do something, probably a special call meeting is not a bad idea, but if something comes up before then, I think Roxanne's right. It probably is helpful to have that authority. So the motion's out there. Do we have everybody in favor say aye?
Aye.
Anybody opposed? Okay, the motion passes. Shelley, what else for director's report?
I had an email from our insurance company, the building insurance company, that wanted to search for, I guess, cheaper insurance. And I wanted to wait until July because our insurance will renew one more time with the current insurance company. But if we do it in July, we'll have time to advertise and put it out for public. And I think we are required to do that. And at this time of year, with everything that's going on and holidays, I don't think there would be enough time for another insurance company to have it done by January, which is when our renewal comes up.
Remind us who we are with on.
We're with Price and Ramey, used to be Southern States.
And who is I remember when we got the policy, I can't remember. Do you know the carrier?
I think it's Utica.
Okay. Well, has it renewed prior?
It will yes, it did. It renewed this year and it'll renew in the January.
In January till July.
January to January.
Okay.
Or for a whole year.
Okay, so.
But I was thinking if we put it out for bid in July for the January of 2022, that we would have time to get everything, let everybody have time to research.
And get some bids.
Yeah.
Does anybody have any questions or comments about that, to just let it automatically renew, and we'll look at it during the course of the year?
Is that the policy that was written through Bible?
No, this is through Price and Ramey, which is Southern States.
Okay.
Bible has,
Workman's comp.
yeah.
Oh, okay. All right. I knew it was something.
Yeah. And I think we have directors and
Yeah.
directors insurance. Is it through Massengill?
I think it's a different company, but
Yeah.
we're all over the place, I guess, but we're trying to get the best
Yeah.
deal. Yeah,
But
we do
those
have
expire at different times.
yeah, we've got a director's liability policy too. So, well, let's make that a motion to let it renew for one more year, and we'll look at it in the course of the year. Can anybody want to make that motion?
Okay, I'll make that motion.
Second. Anybody want a second?
Second. Roxanne.
Okay, anybody opposed? Or any further discussion? Okay, the motion passes. Shelley, anything else? What about the homebound teachers in the community room? Do we want to keep that the same?
I think we could, because they are just very small groups. I mean, they're not even more than one usually. If it gets to be a problem, we could end it. Like if the cases were to get larger or something like that.
For now, you think we're okay to keep doing it?
Yeah, I think so.
Okay, anything else on the director's report?
One other request from Friends of the Library, they wanted to come in to work on the books, but I really think that we should just keep it to staff and these people that are teaching for now. And maybe in January, let them come back if the numbers are better.
Anybody have a problem with that? I'm still a little concerned about, the computers, but I understand that. I mean, there are folks that just really don't have that option, and you just hate to shut it down. You really do. So if nobody has a problem with that, Shelley, that's fine to
Okay.
advise them of that. Okay, any new business that anybody wants to bring up? And remember, as Shelley said, we're not meeting again till January, so speak now or wait 60 days, I guess.
David, it's Kay. I just want to clarify, just like what we decided on the director and you being able to make a decision on how the library stays open or not, are we saying the same thing that you and Shelley and I, the board is saying, okay, if we work on any updates that need to be to the policy about the COVID vaccine traffic?
That's probably not a bad idea, Kay. And we did it, we worked pretty well, other than it was a scramble to get it done before the flu shot started. But that's probably not a bad idea too, because that I don't know that that's going to be anything dramatic so much as it's just trying to make an agreement work with language that is probably less changed by us than the other parties. So if we, Kay, do you want to make that motion as chair of?
Yes. Yes, sir, I will.
Okay.
I move that the board authorize the chair, the policy committee chair, and the director of the library to work with the entities that are involved to develop or to modify, just to work with the plan of how the library facility is used during the COVID vaccine.
I think that's fine. And do we have a second?
Second.
Anybody opposed to that? Joe, I know I always hit you with the medical questions, but are we looking at mid-December for health professionals and then sometime earlier in the year for everybody else? Is that bad information or is that pretty accurate? You're muted. Unmute.
I don't know that that's been confirmed in any way yet.
The meeting that you mentioned coming up this coming Wednesday in Nashville, will that give us some clearer direction, information?
It could. I will get back with you. I'll send David a summary of what they say. David Perky's going to be attending that meeting as well. So we should have hopefully some good information. Probably, as Joe says, maybe still moving dates, but more information.
Well, I think probably before there's the wide distribution that would involve the health department, it's going to be several months into 2021 before they're at that. Kay, that's not too big a stretch, is it?
No, it's not. And I think they came out with a third vaccine either today or last evening that they announced.
Right.
And I think they're all a little different. So I don't know what's going to happen with which vaccine.
We're all
right. And they're going to do the essential workers and the fragile populations first, I think.
Well, I just know this, my mom who's in a nursing facility and my nephew who's works at UAB hospital get one before me, that's for sure. And they'll be in the first wave, I guess, if that's December. Okay, with Kay's motion passed there, Amy, do you want to update us on anything regional?
Okay, first of all, I want to welcome your new board member. My name is Amy Kamani. I am the Regional Director for Holston River Regional Libraries. We are a division of the Tennessee State Library and Archives. We provide materials funding, access to grants, some IT help. I provide consulting services for the libraries, and I'm usually at the meetings just to sit in, listen, and offer answer any questions that anybody has about the state level items. So we also provide training, and as part of that, we do have board member training. It's our Tennessee Trustee Certification Program, and we can get you some information about that. It's not required, but it does help Shelley when she goes to apply for grants at the state level. So
Dwayne, that is a subtle hint that you need to get certified, I think.
I tried to be subtle, I tried. But we can get you that information and just let Shelley know that you're interested, and Shelley and I work together and get you that information. Shelley, I'll also have you fill out a new trustee list for us, for Sarah. Yeah. So we can have that information with email addresses and everything for everybody. Beyond that, not too much going on here. The offices will be closed, as with most places, on Thursday and Friday of this week for the Thanksgiving holiday. And then will be closed in December, of course, for Christmas, the day after Christmas, New Year's Eve and New Year's Day. So if you're looking for us on those days, we will be at home. Other than that, not too much going on. We are looking for training suggestions, as always, for any trainings that the board or staff may be interested in. If you have any thoughts that something you would like me to pursue, please let me know, and I'll be glad to do that. Other than that, if you have any questions for me, that is all I have today.
Kelly, the thought just popped in my mind with Amy's comment there, that your holiday closings are listed in the director's report, are they not?
Yes, they are.
I don't know that we've got to do anything on that. You're pretty much doing what everybody else is doing, aren't you?
Yes.
Okay, anybody have any comments or questions about that? Okay. All right. I suspect we're going to be doing this still in January. Maybe not. Maybe the first wave of the vaccine will help. I don't know. We may not be the prettiest Zoom meeting around, but we certainly are entertaining. That's for sure. Yeah.
Well, I said that y'all are pretty, so y'all pretty.
Thanks, Dwayne.
If
And on that
anybody
note,
has anything else, if not, we're adjourned.
I just want to let you know that as of right now, the executive order for that allows for these meetings expires at the end of December, but we'll probably know that final week, probably about a day or two before the deadline, if you'll be able to do this in January and beyond. So as soon as I hear anything, I will of course pass that on to Shelley, and she can pass that on to you all.
Well, to update everybody, we did a few Zoom back in the summer, and I think we were trying to comply with the order. I'm not sure we were as compliant as we needed to be, but I think Shelley has worked on it with some help with technology, and I think if we're not compliant, we're sure trying. So hopefully, if we're back here again in January, as we probably will be, we're getting better at it. That's for sure. Okay, anybody have anything else?
I was just going to tell you, I texted Sunil because you asked, and I said, is vaccine coming in December? And he said the 11th, but all he wrote was 11th on the text. So whatever that means.
He's a doctor of few words, I guess.
I spoke with Marshall. He's on the task force. And I think that 11th day is for EMS. And then when
Right.
the hospital workers need to be vaccinated, I think the health department will go there. I don't think there'll be any driving through the health department.
Oh, yes.
Until.
Yeah.
No, that's going to be very specific to first responders and healthcare folks. So we're looking sometime early in the year, hopefully, before we have to deal with the vaccine parade or whatever we want to call it through MUS and library. Okay, anything with anybody else? Okay, everybody have a good Thanksgiving, and we'll see you in 2021.
Thank you,
Bye.
Shelley.
Thank you.